She actually has it. So the only thing I'm going to check is counterclockwise or clockwise. So that is the one additional muscle testing thing that is just on this video, is twist, check, twist, and you don't go the way that weakens. Logical. So we actually want to go clockwise. So when we do our actual therapy, because you guys can do this. This is super simple. It is like tractioning the skin and then just allowing the breath to make the movement. It is really light pressure like that. So the first one I'm going to do is going to be a lift of the frontal bone. So I'm just grasping kind of on the maybe above the temples, and I'm putting pressure out this way. Just skin pressure. So you're feeling a little tug on your skin, right?
Very light.
And then we're going to do the twist. Now we're on the temples, so down just a little bit, and then I traction down here and up here. That would be the clockwise. And people do hour-long sessions of this, so you can do it as long as it feels good, especially when somebody else messes with your head. It feels good. The next one is back on the parietal. So just above the ears, you're putting in finger pressure there, and then the middle of the top of the head. You getting that? Mm-hmm. And now the movement here is, if this is the parietal bone, we're kind of lifting it out this way. So on my fingers, I'm kind of squeezing in like that. And I do both sides, and I just put pressure pulling upward above the ear, and then on the thumbs I'm actually pulling my thumbs apart. And then the next one is inside the ears. You grasp, you get your thumbs in on the little hook there. And then you pull down and out just a little bit. And then the last one is under the skull. You're just grabbing the base of the skull and you're tractioning outwards. So under here, I'm just pulling headward. And you just hold the pressure and just allow for a few respirations. And the therapeutic benefit of all that is it helps the cerebrospinal fluid to flow, and that's supposed to affect every inch of your body. Your thumb could be caused by cranial pain. Your gallbladder could be caused by a cranial motion defect. And there's a lot more you can learn about cranials, but this is all that I do, and it seems to suffice in getting the muscle to be strong. Now, she didn't test for this, but we're going to do the TMJ also. And you could do all those yourself too, right? You could do this.
Mm-hmm.
You can traction out
So
this
you
way.
have to test clockwise or counterclockwise, right?
Yeah, you just go like this, test, and see which one weakened. So TMJ, if that shows, you do want to do a little TMJ correction. So you can do it, just grab your teeth, or if you're going to do it to somebody else, I've done it to my kids and not used a glove, but most people prefer. So I'm just grabbing on the teeth, hooking on the jaw, and then from here I might just brace, and I'll put pressure down, out, back up, and I'll set it back on the thing. And the motion is really tiny. So I'll show you, you won't even be able to see, but she'll be able to feel it. You can almost see my hand move, right?
Mm-hmm.
And so it's just this tiny little circle, down and around. And
Okay.
what's going on behind that is you're setting it back on the disc. There's actually a disc in the opening jaw. And then you do the muscles. There's 4 muscles associated with the TMJ. One is back in on the back of the mouth. So open, you just go between the teeth, and if TMJ shows, you'll find some tender spots on that fleshy part back there. This one is tender on every one, so I just give a little, it's right under the angle of the jaw there, so I just poke under and just do a little massage. You seen that? And then anytime you do a muscle, we should do IRT. Pull. And then of course the most famous jaw muscle. And it does go basically all the way up to the cheekbone. And pull. And then there's a muscle that comes up this way. And when it's injured, you'll feel bumpies on the skull because it's a very thin sheath of muscle. And she doesn't have any of those bumpies. And do, and that's the cranial TMJ. So I'll put them on split apart. So like if you get TMJ, you just click it on and follow along.
How do you test for TMJ?
You can shut her off.